I'm John Paul from CAN, or the Council Advertising Network, and I help, and the team help, lots of ICB and council communications teams to essentially have a little bit more clout in terms of the communications that they push out and the communications with internal stakeholders. But today isn't about me. Today is about improving the efficacy of childhood immunisation campaigns. What can we do to drive uptake of a range of different immunisations, be it MMR, polio, HPV, and even COVID? Now, the reason we're doing this today is my wonderful communications manager, Karen, looks at some of the topics that we're getting asked to help people with, and then puts together very quickly an array of experts so that at the time that you probably need inspiration and insight into what makes things work, you have this useful lunchtime event, hopefully, which gives you the benefit of these experts' insight, which you can then take away and incorporate into your work. And today, I'm very pleased to have two really big experts in the field. We've got Russell Cartwright from South West London ICB, and he's a behaviour change expert, has a wealth of experience in communicating immunisation in South East London. And also Leanne Hughes, who works for Healthcare Improvement Scotland, and she's an expert in communicating with children and young people. And I've seen excerpts of her work over many years, and I'm very excited to have them both here. Before we start sharing their expertise with you, I think it's worth setting a little bit of context. Communicating childhood immunisations, the benefits of and driving uptake could be arguably the toughest communications challenge that we in the public sector have to address. And it's not just tough because of the subject matter or the parents, assessing risk for their children, but the environment in which we communicate has never been more complex. The communities and the audiences that we need to communicate with have never been more diverse, and the amount of noise and vaporware and frankly huge complexity that we have to take on means that before we even start, there are some significant challenges. And so I wanted to sort of turn to you, Russell and Leanne. Russell first. It would be great to sort of outline some of the things that we are up against when communicating immunisation for children to various audiences. What have you found in South East London that have been particular challenges?
Thanks, John Paul. So I'm getting an echo. I think that's yeah, okay.
We can't hear it, don't worry.
Okay, cool. So as you said, there's lots and lots of competing messaging out there at the moment. I think a big thing as well is we don't have the kind of direct drivers that we had of the threats of more lockdowns or the real kind of immediate threat that COVID stood a few years ago. There's a lot of vaccine lethargy about. Let's face it, vaccines aren't people's priority at the moment. Cost of living is, or all of the other things that are happening. There's a lack of understanding of the seriousness of some diseases, which had, in many people's eyes, gone away. And I think there's also a lot of negativity around health services and accessing them, as well as a lot of immediate health needs that kind of the after effects of the pandemic, mental health needs, and things like long waiting lists, difficulties, getting appointments with GPs, etc. So people have got other priorities than vaccines at the moment.
Absolutely. And Leanne, in terms of your experience and of the barriers that you might encounter when communicating with young people, what do you find are the challenges? And we'll get into how you overcome them later on.
I think what Russell was saying there, I think there's a lot of fatigue in terms of any kind of vaccination, and over coming out of, even for young people and the choices that they're making. They very much are a generation who make choices about what's going in their body, for instance. So we were talking when we were meeting yesterday about this, and I think the choice about things like such as hormones, if you were looking at contraception, for instance, as an example, there isn't, we're not in a place in health where people just trust it as that's what you do and that's what you go through an immunisation programme by a school nurse. It's very much a different landscape now. So you're working in that context. It's really important to know, as practitioners in public health or wherever you're working in health, if you are in health, that it's really tough. And it's things that would have maybe just gone through automatically in the past. We're not in that place, and we're not in that place because of what's happened in the last few years, and we're not in that place because of how young people think about their bodies these days. So I think the context of that is really important in terms of how and when your messages will land. We have to be mindful of that, basically. So that would be my take on it for where we are just now in this world.
Not beautifully so.
Yeah.
Indeed. Thank you so much. Beautifully summarised. So with all of that context and all of those challenges in front of us, behind us, around us, there is hope. There are things you can do. And the point of today is to share some of the things that Russell and Leanne have learned. So Russell, if you'd like to start sharing your screen, we're going to get a view now from the view of someone who's very experienced in behaviour change, very experienced in delivering immunisation campaigns, as to some of the things that work. So Russell, over to you. Sorry, Russell, I think you're muted. We can see your screen as well, so that's working.
There we go. Yeah, sorry, when I shared my screen, all of my settings changed and I couldn't find the mute button. So yeah, thanks, JP. Yeah, as mentioned, I'm Assistant Director of Communications and Engagement, employed by the NHS, but in South East London, ICS. And I've been lucky in the last 4 years. I've become a bit of a specialist in behaviour change campaigns. I've led a number of ones that have won multiple awards in South East London. But I'm also really passionate about kind of helping share that knowledge in the public sector. You know, I've learned so much, and I really want to help others, do and embrace behaviour change and behavioural science techniques in kind of day-to-day work and in our future kind of campaign working. So I was asked to share some kind of learning from recent vaccination campaigns, and there's a few kind of pointers on this screen. I'm sure lots of people on this call will have your own kind of learnings and your own things, and these are only just a few kind of quick observations from me. But yeah, just thinking about MMR and measles. I think for children and young people, I think this sounds obvious, but the key thing is targeting the parents and targeting their reference networks. And that's not to say, we're aware of a kind of cohort of people who are sort of 19 to 25 who maybe missed out on their MMR jabs, and there is still work to be done with that group of younger people around trying to get them vaccinated. And we're in Greenwich, we're looking at things like joining up with the local universities to run some events. With COVID particularly, we noticed a really high level of vaccine resistance amongst parents of 5 to 11-year-olds. The campaigns that I led was mainly digital, and quite a lot of that was possibly a noisy minority who were, influencing others. But the other thing that we really learned with COVID is about this whole kind of spectrum of vaccine resistance. I think early on, lots of us tried to really kind of target and try and change the minds of, anti-vaxxers and I think we learned quite quickly that we're never going to change their minds. But there is this whole, you've got the kind of the percentage at the start who are your early adopters and will queue up as soon as the vaccine's available, and then you've got a really big group of people in the middle who aren't quite sure, or there are different barriers that might stop them doing it, and those are the ones that you really need to try and influence and try and persuade to take the positive actions that you want them to. I think I talk a little bit later about a lack of information, but there's something about parents wanting actual factual information and having the opportunity to ask some questions and have them answered by someone they trust. And I think some of the trust has eroded in terms of public authorities, but generally there is still a high level of trust amongst individual clinicians on a kind of face-to-face basis, or an opportunity to talk. So things like Instagram lives and Facebook lives are a good way of giving people a chance to ask those questions. Interestingly, with COVID and with the younger cohort, we found quite a lot of schools were quite reluctant to kind of own and really push out the COVID vaccine messaging. We gave them toolkits and things like that, but uptake of that was quite low. And I think some of that is due to the clinical case for vaccinating that cohort being not as strong as older cohorts. But I think with MMR, obviously it's a younger cohort, but there is a real opportunity to work with children's centres, because that case is obviously much clearer, and nobody wants an outbreak of measles or mumps, or so there's an opportunity there as well. Interestingly, we presented parents with a really simple choice architecture, and parents generally don't want to turn up to a walk-in centre and potentially wait with their young children. They want to know when their appointment's going to happen. They want to avoid waiting. They want to prepare their child for it. I mentioned earlier the lack of awareness of risk, and the sort of complacency around things like polio, mumps, measles, rubella. Because they've almost been eradicated, there haven't been outbreaks, or serious outbreaks in this country for a long time. And then the other thing we learned, particularly with polio, work we did around polio fairly recently, is not just to focus on vaccines. I mentioned earlier that vaccines aren't very high up people's priority list at the moment. So if you're going to do outreach activities, do other things that people are concerned about, maybe do blood pressure checks, cost of living, financial advice, mental health, sexual health, all of the other things that maybe are a bit higher up people's to-do list. So yeah, that's just some of my learning. Some principles that I think can be used across vaccination and public health campaigns. So I mentioned behavioural science, and it really has been, the campaigns that I've been involved in over the last years has really changed my outlook on campaigns. I've seen results that we've never seen previously in terms of real kind of meaningful results, with people actually taking actions, looking way beyond just kind of reach. And I think what I would say, although John Paul introduced me as a bit of a behavioural science expert, I'm not. I've learned a lot. But what I would say is don't be afraid, and don't be afraid of the science. And you don't have to know all the answers, and there are people that you can bring in to point you in the right direction. But what you really do need to do is embrace the change. Things are different. If you're going to do a really good behavioural science campaign, you will work differently to previous campaigns that you've worked on. COM-B is some people may have heard of that. It's a great starting point for any kind of campaign planning. You map out kind of capabilities, opportunities, and motivation, and these three areas are areas that you can use to kind of change people's behaviour. It really helps you understand what causes behaviours and how you can nudge people to make the positive changes that you want to. I know it's hard in the public sector. It's even harder at the moment than it's ever been. But if you're going to run an effective campaign, you've got to use paid for adverts. You're not going to reach people with organic stuff, unless you are a wizard and can, really pull something that's gonna grab people's attention and get shared widely. You're just not gonna get any reach with organic. You're wasting your time. So even if your budget is small, putting a small budget to something digitally is really important. Segment your audiences, target them by age, interest, where they live, or that sort of thing. Do as much of that as you can, and that is quite simple digitally. Localize your messages and test all the elements of your creative. So we do a lot of testing with the behavioral science, and you will scientifically test all the different elements, like I say, and I'll talk a little bit more about that in a moment. Don't be afraid to try new channels. On this slide, there's a Snapchat AR lens, which we found we had really good success with younger people using Snapchat. I'd never used it before. I still don't fully understand it. But the reach and the engagement rates that we had using Snapchat were amazing. So and video on demand, again, I've never used that before, but we were placing adverts really localized by postcode on things like Love Island, programs popular with different segments. Use influencers where you can, and that could be national influencers, but also local influencers, your faith leaders, your people who are community leaders in your communities. Again, it goes back to that point about people wanting to hear the messaging from people that they recognize and trust. Take a risk. Some of the campaigns I've led, we've had high engagement levels with certain creatives, but they've been a bit controversial and they've attracted lots of comments negatively. There was an image we used of a lady for a mental health campaign, of a lady with a burqa, wearing a burqa, and we attracted lots of racist comments and lots of comments from people within the Muslim community who were questioning why we were using that. Instead, the easy option would have been pull it, but we kept it and we responded to it appropriately, and it had such a good engagement rate and such a good reach. So don't just take the safe option if you want to maximize your impact. With any good campaign, digital campaign, don't underestimate community management. It will take time. You'll find yourself responding, etc., to lots of different things that you wouldn't necessarily would have predicted. And I think where you can, supplement what you do digitally with face-to-face activities. So just kind of some of the barriers. And on this slide, I haven't got time to go through it in a lot of detail, but the right hand side kind of illustrates how once you've done your combi, you will you'll develop a kind of messaging matrix. So you'll look at the barriers that you've identified with the combi, and then think up kind of the messaging that you will use to kind of overcome that. So, for example, this was from COVID and younger people. There was a lack of adequate information about where to go and where to get it. So the way you do that is you make it clear, and your messaging kind of reflects that. There was. Well, I think in terms of time, I'll let people read that. But so some of the other barriers, misinformation, the links more than 20 years ago, the Andrew Wakefield effect. So after 1998 and his paper, which falsely linked MMR to autism, we're still dealing with the fallout from that, really. In a few years after that paper came out, MMR rates dropped to as low as 61%, in 2003. And there's evidence to suggest that the rise of misinformation and disinformation during COVID also increased hesitancy generally. So that's clearly still an issue. There's a lack of adequate information sometimes, but then there is also information overload in that there's lots of other, lots of competing information, some of which is questionable, or lots of which is questionable. And there's also this increasing questioning behavior, which I think Leanne alluded to briefly earlier, but people are, years ago, you would go and see a doctor and your doctor would say, okay, it's time for Johnny's MMR vaccine, and you wouldn't question it. It would happen. I think now people question a lot more everything that is put into theirs and their children's bodies, and people Google things, so that does create a bit of a barrier, can create a bit of a barrier. mentioned earlier vaccine hesitancy and lethargy. You know, we've put out, there's been so much messaging locally and nationally about vaccines over the last 3 years that people are becoming a bit blind to it. They are, you know, they are not another, you know, vaccine. Surely I don't need that. People are also complacent that, you know, the diseases that have, like, as I mentioned, have almost been eradicated aren't that serious. They don't understand, you know, the serious implications that could come about from some of these diseases. There's environmental factors. You know, we talked about some of that earlier again as well. Access, and also, you know, cultural and religious beliefs. So data is really, really important to running a good campaign. You know, getting really good baseline data and doing your research before the campaign is vital, I would say. And sometimes you need to do that really quickly. But what I would say is don't scrimp on the effort. You know, if you need to put some resource in or spend some time at the start, you will reap the benefits of that much later. I mentioned testing scientifically. So with our creatives in our campaigns, we would, for instance, we would test 5 different versions of text on an advert with the same image and the same wraparound copy. We'd find which one worked best, and then we'd do another test with 5 different images and the same text on them and see which image works best locally. And then we'd repeat that with the wraparound text, and just that sign. And then by doing that, what you know is where you really, really maximize the impact your spend on those adverts is going to have, and you learn what resonates with people. And I questioned that when we first did it, but virtually every time that I've done that, I've been surprised by the results. You know, the one that the creative that I thought wouldn't perform at all has performed best, time and time again. Track everything so you can see what people do when they see your adverts, where they go, what actions they take or don't take, and change things if they're not doing what you need them to. Run bursts, adapt as you go. And I think the real thing is measure more than reach. You know, so many campaigns just, you know, they give you a massive figure about your adverts have reached so many million or hundreds of thousands of people. Well, that's useful, but what you really need to know is what have they done when they've seen your adverts. And on the right hand side, there's just an example of some of the real outcomes that we measured in one of the campaigns that I mentioned. I think this was COVID vaccination for 12 to 17-year-olds. So you can see people are clicking on our links, the vaccination rates are increasing, and also the negative sentiment has decreased. So just to conclude and just to show, I'm not going to go through these, but this shows when we've done the tests, what I talked about, segmenting our audiences, and these aren't massively different, but there are some variances. So 12 to 15-year-olds, you know, the messaging there is slightly different. The successful messaging that we use there, slightly different to the 16 to 17-year-olds, slightly older cohort, and quite different to what worked best with the reference network, so parents and grandparents, effectively. So yeah, I'm gonna stop there and hand back to JP.
Thank you so much, Russell. That was absolutely brilliant. There were quite a few things that really stood out for me there. You know, targeting reference networks, Snapchat being a very important one, and focusing your messaging and targeting on the undecided rather than the entrenched, I think is brilliant advice. And we've seen that working where we worked in other places as well. Another thing that surprised me is that school participation can't be taken for granted. That was something that I'd assumed would be something that's easy to do, but no. And I love the idea as well about orienting your communications around other priorities, cost of living, health checks, things like that. I think when you've got fatigue around vaccine messaging, or it's a messy space, talking about something else like health checks, like your family's health in winter, really strong approach. I also liked, you know, behavior change theory or behavioral science can sometimes seem like this inaccessible box of wizardry, but it can be simplified and applied as a kind of filter or a structure on which to build campaigns. So don't fear it and use it. One thing that I've been trying to get across for so long is that, you know, organic doth butter no parsnips. It doesn't. It's good. It's a log. It's publishing, but it doesn't reach everybody you need to be reaching. So augmenting that with paid is really important. And I think often I see campaigns, and we must all experience this, that start with a really strong creative idea, but then get watered down. And you know, you being brave and sticking by what you believe in, what you know is right, despite what the haters say, is, I think, you know, really good advice. Platforms also thrive off controversy, so it does actually improve performance as well. And I'm sure Leanne will start to take us through more of this in a little bit. But that point about being data-led, gut instinct is probably good and useful and reliable based on your experience, but there will be surprises in the data. And I think that's where, you know, this superpower in the public sector that we have of sharing in events like this, but also as campaigns run, to find those little nuggets, those little outliers, creative messaging that seem to really resonate, and sharing that quickly with each other, I think is a wonderful thing that, you know, if you work in the auto industry or the finance industry, you're not able to share with other organizations that operate, but we are. So thank you, Russell, for sharing. That was brilliant, and you managed to cover so much in such a short space of time. But now I think to really zoom in on the messaging, and how you engage younger people. I've seen, it's a bit like when I speak to teenagers, I try and demonstrate relevance. I sometimes break into a rap. It all falls dreadfully downhill. And sometimes public sector organisations can miss the mark by either being too corporate, or not necessarily understanding what their audience, probably sometimes underestimating young people. So this made me think immediately of Leanne, who I've seen snippets of her work over the years, and she managed to get that authenticity, manages to get co-creation, all these wonderful things that we sometimes talk about but don't often do. So Leanne, if I can pass over to you, and you could take us through some of the things that you've learned on your journey communicating with children and young people.
Thanks, JP. Can I check you can see my screen all right there?
Yes, we can.
Brilliant. Okay. Good afternoon, everybody. So I'm just going to go quite quickly because I'm conscious of time, but I am very happy to hang around for questions after this session. But a bit about me: I am Leanne Hughes. I'm a chartered PR. I am very proud of my chartership. I live in Edinburgh. I've worked for the NHS for 20 years in and around youth and children's health. It's my speciality and the thing I love to do most, and I have 2 teenage children and a daft dog, and that's a bit about me. So I've worked in and around many amazing campaigns. I've been very lucky in the subjects that I've worked in over the years that I've worked in health, and pretty much most of them are controversial because it tends to be what attracts me. And I like what Russell was saying there in his amazing presentation. You know, you can't be fearful of your content. You know, you've got to go for it, and sometimes that's hard with your senior managers, but it's basically probably what I've built my whole career around, pushing the boundaries a wee bit. And that includes this one here, which was a running willy around Edinburgh for a condom campaign. It's still my favourite, actually. So it's my work's included many sensitive topics like abortion services, RSHP, which is our sex education curriculum in Scotland. That's what it's called, and if I refer to it, that's what I'm talking about. And that's for all age and stages, so from nursery all the way up, for sex ed in schools, basically. Recently, I've worked on this campaign called Awkward Moments, and that is about enthusiastic mutual sexual consent. That was a behavioural change campaign, very much following what Russell has just talked about in terms of process, and could do a presentation on that alone. So I won't go into too much of it, but just really want to echo all of Russell's points in around how we run campaigns and why COMBI is really like an important process to follow. And then recently I've moved over to Healthcare Improvement Scotland now, which is connected to Scottish Government work, and I've been working on a piece called Bairns House, which is supporting young people who are negotiating the justice system, who've been victims of abuse themselves, and it's been a bit of engagement work with young people recently, which has been a new subject for me, but very meaningful. And it just goes to show you can apply these principles to any topic when you're working with children and young people. So I'm just going to go over quickly rules of engagement about asking and testing. I'm not going to go into too much of that because Russell has covered it there. Building trust amongst children and young people and their parents and carers a wee bit. What my best practice tips are for a process. And use of social media outside of organic channels. Again, I won't go into too much because that has just been discussed. So here we go, there's the meme, we all see it, but it's true. Meaningful engagement does not mean children and young people are your sounding boards for your work. And I want to talk a bit more about best process and putting the children and the young people at the centre of the work in a bit, but I mean, I think I can't stress it enough. You have to be authentic in your approach from start to finish, and the young people and the children that you're working with will recognise that and they'll know it if you're not. Again, I'm going to echo what Russell's just talked about COM-B approach. And, you know, it's really important to do your desk research. It's really important before you write a word that you understand what your barriers are for your messaging. And I do really think, you know, we have to break that down in terms of best practice, because even if you can just do the smallest amount, it will help. So it doesn't have to be this big, you know, expensive process that we have to bring in a ton of experts in public health or NHS, where we just don't have it. We don't have it, let's be realistic about it, but you can learn, go on the training, learn these processes. It will really help you land your messages. You know, it's simple really, but take the time. And, you know, because this diagnostic work, basically, it'll give you your best chance of getting through to folk. And we really do need to know if they have capacity for young people, children and young people in all senses, from accessibility, from inclusivity, you know, from can they understand you? Do they understand your message? Do they understand what you're saying? Because they might not. You need to really be thinking about that. And then assumptions about what children and young people need and want. I know this is an obvious thing to say, but it doesn't matter what your children think or what your nieces and nephews think or what my children think. You have to ask young people, and assumptions can happen a lot at the start of a project. Don't assume anything. And I did smile at Russell's point about the ones that you think will land. Don't ever. It's never the ones you think will land in terms of creatives. You know, I get shocked about that. I think, well, it's what I like. It's not what they like. And it's, you know, when senior management do push back on things, this is what I always say: it's not for you. It's not for you. It's for them. And they say they like it, so that's it. And you know, we've got to ask and we've got to test and we've got to ask and we've got to test. And we have to, even when you're short on time, even when you're being told this has got to go out the door, push back. We need to ask and test, even if it's the smallest amount of testing that you can do. Find a way of testing before you put things out with your audience. Again, an obvious point, but really, really important one. And then for me, I've worked with young people in, you know, like myself in person for many, many years. Get in the room. They are an amazing group of people to work with. I mean, generally, I've worked with 13 to 18 most of my career, some primary school children as well. But respect is key, and you know, you have to treat them as partners in the work throughout, and that means good processes. It means looking after them through the process. It means paying them. It means building that in so that they're looked after. But you know, their voices are genuinely heard. I mean, anyone who works with me knows that it's absolutely what has to happen when young people are involved in the process. So my little calculation here, or my equation, I should say: quality, inclusive, accessible, kind. Kind is a word that isn't used very often, but it's key. Non-patronising outputs means that you'll get improved engagement, and I'll put my hat on that. So in terms of parents and carers, it's pretty much the same in terms of like a process, really. But for me, it's about making sure that when you are working in sensitive or polarizing topics like vaccinations, and we've all seen what's gone on Facebook groups, school Facebook groups, you know, the goal for insights in terms of what some people are thinking. you know, parents and carers need space and time as well. It's their charges, it's their people, it's their individuals, it's their children. You have to give them time and space. So this here is an example of information leaflet that was created to support RSHP, which is our sex ed education training in my previous post. This was tested with parents and carers for whether they understood it, and it was particularly about what topics were being taught at what age in primary school. So if you're talking about sexual health in primary school, obviously that's going to kick in worries about and opinions and, you know, cultural issues or differences and opinions about what they're being taught in schools there. So I think it's the same process really about going the extra mile of engagement, think outside the box, take the time, get involved with your trusted partners like your schools, establish Facebook groups, social media groups, you know, don't go in there shouting the odds, but hear what they're saying and take the time to listen, really, because they're your insights in terms of what your barriers are. You know, it's about taking the time to get in and amongst it, really, to be able to really, you know, discuss it as adults and say, right, okay, what, let me address this bit of misinformation. And then for us, for young people in primary and trying to bring on the content, you know, it was about addressing misinformation so that age and stage content was going out at the right time, as far as we're concerned, from expert point of view for content. And then the teachers and the people who are actually having to deliver the information were supported, and they really were, they came on board with us because we did this work with the parents in, like, directly, and that, you know, that makes their life a lot easier when we're talking about something like RSHP in primary school. So again, same thing, quality, inclusive, accessible outputs, improved engagement, make it look nice. I'm a huge advocate for things looking nice, and I will take the time to do that, whatever I put out. So for me, just wanted to finish there really with a bit around good quality practice and working with and for children and young people, and my non-negotiables. So I won't go into too much because I have written a blog about being authentic and particularly about commissioning for a youth audience. It's something I'm quite passionate about as an NHS employee. You know, when we choose our supplier, it's really important when we're thinking about this audience, and it is something that I will push back on in terms of who should get appointed to the work if we have the pleasure of a budget to go external. That is, you know, we don't always. So do pop over to my LinkedIn and have a look at that Be Authentic blog there. That will give you a bit more detail if you're interested. But in summary, what I'd say is set up a steering group of young people right at the start of your process and work with their trusted adults like youth workers or their cool teachers, the teachers that they like, the guidance teachers, so on, so that they are then supported appropriately. You know, they need to be protected, especially for subjects I've worked in around sexual health, for instance. You know, they need to be protected in the conversations. Get the buy-in from your senior leadership for the time it's going to do the work well, because it's graft. It's patience, and you need really good diplomatic skills to deliver meaningful engagement and then to negotiate when, for instance, young people want a certain creative or message, and as NHS employees we can't quite go as far as they want us to go sometimes. And, you know, it's just walking the line in terms of getting the information that they would like to be told, and what we need to do as professionals, and how to manage that, really. And then if you are commissioning externally, select your supplier really carefully. Again, in the blog there's quite a bit of detail here, but do things like, you know, for the Awkward Moments campaign, we had young people on the interviewing panel for the pitches. They were there alongside us. We asked the people who were pitching to provide a pitch that was suitable for young people, and they scored them. They were amazing in the interview process. They really helped us in the interview process. And then you need people who will be with you all the way along the line of a meaningful engagement process, who will understand how much extra work that will take from a billing point of view, you know, from like the hours that will take. It will take a lot longer to have these young people along with you throughout the process. So it's something to really think about. Can they do that in the way that they're set up, because what they promise and what actually is billable hours might be completely different. So really think about who you're employing and commissioning. And then I'll not say too much about this because I really am reiterating what Russell has said there, but this is just a measurement evaluation from our impact report from Awkward Moments campaign, which is available and it's online. It's for anyone who wants to see it. Again, TikTok, Snapchat. I've been working over like nearly 20 years in youth health, and I've never cracked organic social media. And if you've done it yourselves, then like I would love to speak to you and find out how you do it, because it's just I echo it's impossible, I feel, to get any kind of traction. So we have to work really hard in partnership with youth services, for instance, who are their trusted people, and like exactly what Russell was saying there, getting around the other topics. Where are they? What else are they looking about? What's important for them at that point to be able to sort of weave in what you want to say, really. And for us, for Awkward Moments, it's TikTok, really. I'm really, really interested in understanding the use of TikTok, especially there's a bit of an education arm in TikTok, and I'm personally really interested in having a wee look at how we in the NHS can use that for this audience a bit better than we do for my personal practice anyway. And that's it from me. It takes much more time than you ever think it will to do meaningful engagement with children and young people, or any audience really. Plan for it and negotiate with your seniors, because it'll be worth it. You'll get the results if you do the work. Sometimes it's really hard though, and totally get it. When we need to put things out the door, it's not always easy in reality, in the busy NHS world that we're all in, or if you're in health. And then meaningful and respectful youth involvement equals early participation. Get them in it right at the start. I can't stress that enough. You're not sending something you're not sending a fait accompli to young people to verify for you. That's not what it's about. Check in, give them time to check in throughout the whole process, and get them to sign it off. And that's it from me, JP. Thank you.
Absolutely brilliant. Thank you so much, Leanne, and Russell, for your presentation. You're listening to experts when it just seems clear and simple to understand, very complex issues distilled into something that we can use very quickly. Some of the things that really stuck out for me there were having those difficult conversations internally at the beginning, explaining how tough this is, explaining how likely failure is, getting budget to make sure it happens. A cheeky question you can ask: if we do nothing, what does that mean? And then working back to maybe we need some resources for this. The point about authenticity, being yourself, then engaging with young people who are not a homogenous group. So all different ages across those groups, they will have different trends, different things they're interested in at all those different ages. And then that connection in person will build the authenticity of the communications, which will build trust with those audiences, parents and young people alike. I think that is absolutely got, so that the bravery required to engage and be authentic and then co-create with those audiences and shape those messages, I think is absolutely vital. The idea of kindness rather than confrontation, and something that our good friends at 22 Design, Dave, would say, you talked about making it look nice. They regularly make very complex things very sharp, bright and shiny and palatable, and we see 2 or 3 times increases in interaction rates when things just look good. They're not that clutter of logos and 3-letter abbreviations and expert advice to say, well, tick box communicated. Another point there about the organic and moving to those channels. Yes, to Snapchat, it's great. TikTok's also great, but TikTok's geo-targeting is appalling on paid. So Snapchat's going to be a big one. Meta, I predict, going to be used way less over time. So with this audience, Snapchat, yes, Google Display Network, Meta certainly a little bit for parents. But yeah, one thing as well, that key point, things taking more time than you think, which segues rather nicely into my the few bits I want to share with you. But doing too little for too late for 2 weeks is something we really need to get away from. Communicating whilst the house is on fire is not as effective as taking time and moving towards sort of always-on campaigns, where you take beautifully crafted messages and deliver them consistently to an audience. Look at the data, look at what's working. Many of these problems aren't going to be eradicated in a couple of weeks, a couple of months. You need to really move to have always on communications, very low volume, but going to exactly the right people at the right time. So I put together, I will go even faster on this one, just I'm conscious of you and your lunch breaks. Basically what we're trying to do to improve the efficacy of communications, we need to move away from too little too late for 2 weeks towards always on search, tactics like gentle remarketing over long periods of time, using public sector channels. Councils are the biggest media owners in their areas. They can deliver so much reach frequency with very specific audiences. And that's the way that when we've tried it, we've seen measurable changes in behavior and also sustained changes in behavior. You can sometimes achieve an outcome and it's not necessarily sustained for long periods of time. So just wanted to whiz you through a few new things that we're seeing are going to be used more rather than traditional routes. The use of in-app alerts across a public sector set of apps. For example, getting an alert through the Met Office app or the Ringo app when you turn up outside a primary school at between 8:30 and 9:15, nudging you to say, are you confident your family are up to date with their vaccines? These highly targeted interventions are likely to be part of the arsenal versus spray and pray channels, which you kind of know deep down aren't reaching the audience that you want to. Use of search and I'll show you something a little bit that we're giving away for free today, but the use of search data to identify what's actually in people's minds and then to accept those queries with routes to the right information or the right pathways, we think will happen a lot more when we're trying to reach these audiences. Another, if you've got people looking, as Russell was alluding to, people looking at cost of living, something that's pertinent in their minds, but also things like school term dates. These are great ways on council channels of delivering messages and maybe remarketing messages to people that have interacted with that content. Rather than paying third-party platforms for their data, you can use your own, and it's incredibly powerful. And we believe more of that will be done in the future. Another point was made about using the data, seeing a correlation between your communications and uptake of vaccine. You've got to get this happening so that you can prove to the stakeholders that this is investable communications and they can invest in it reliably over a long period. You can also see what happens to be resonating and what not. This was from Nottinghamshire. They used a creative on Snapchat designed to get young people taking the vaccine with the opening title, "Look at these pricks." Same problem. Lots of senior people say, well, I'm not quite sure about this. But the very brave individual said, let's just do it and apologise later. And it worked incredibly well. It was the most successful creative in the campaign. One thing with public sector audiences, and again, what Russell was alluding to about engage with what they're interested in. We think there are lots of things that the public sector communicates that overlaps. This is my first attempt at trying to do this, and this is an even worse attempt at showing where these audiences and campaigns and messaging can overlap, and thinking about running campaigns together, health checks, Christmas activities and childhood immunisation. They're going to be the same audiences. We can deliver lots of messages to the same people in a much more efficient way. Just to quickly show you a few things as well. in terms of use of council channel, organisations like Sheffield or Havering Council are generating income to fund campaigns on their websites, but then also use this space to target messages like fire and water safety to parents around school term dates. We expect in Sheffield they'll be using the school term dates pages to promote MMR vaccination very shortly. And the last thing I'm going to share with you is this is something that lets us see search terms in a specific location over the past 3 years. So we can see trends and changes in terms of what people are looking for. And we can zoom in then on very specific terms, because knowing what's on your population's mind is a great way to start shaping and tailoring a campaign so that you can basically remove a lot of the things that you might be thinking of and zoom in on the things that people are actually talking about. It's great for making creatives, and it's great for maybe pushing back against some of the things that you might be being asked to communicate. Now, anyone on this call, we're giving this data away in your location for free. All you need to do is drop me an email and we can give you a childhood IMS report for your location. It doesn't do every location. So, for example, London is one globule, but that data is useful to check, are we talking about the right things, and where are the trends, what's going up in people's minds, and so on. So all of you are invited. Drop me an email and I'll create you a report on childhood immunisations. Also, very conscious of time. In terms of questions, I might suggest, if that's okay, that the speakers will take a lot of the questions. We'll get back to individuals when we send out the video after this. I hope people don't mind that we've gone over, but it has been so rich from start to finish, and Russell and Leanne have really squeezed everything into a very short space of time. Thank you so much to them. I really hope that you're able to take at least one thing away from this, and it makes your life a bit easier and a bit more rewarding. Yes, I hope you have a lovely weekend, and we'll be in touch soon. Thank you so much.